Wardell Sanders is the president of the New Jersey Association of Health Plans. We welcome you here to talk about the Affordable Care Act. Good to have you here.
Thank you for having me, Laura.
You know, it's funny, Matt Locker was just mentioning it is National Simplify Your Life Week, but when it comes to the Affordable Care Act, it's complicated.
It's very complicated.
It's complicated, and we want to focus a little bit about a health exchange, health insurance exchange that's included in this. What is that?
So, most people haven't heard of it, a health insurance exchange, but the next year folks are going to hear a lot about it. So a health insurance exchange, very simply put, is a one-shop stopping experience for consumers and small employers to purchase health insurance. So right now in the United States, most people get coverage through their employer, and if you work for a large employer with, say, 500 employees, they have sophisticated purchasers and HR departments to help shop for coverage. They're sophisticated purchasers. Mike's Bike Shop with 3 employees or an individual purchasing on their own have a much more difficult time in shopping for coverage. The idea behind the health insurance exchange is to put all those resources in one place so consumers can better understand what options that they have. That's sort of the easy description.
Okay, so is that a public-private partnership? Is that going to be government-run? What?
Yeah, it's going to be different in each of the states. So the Affordable Care Act, while 2,000 pages long, as you said, is very complicated. This is a key component, and it does give states flexibility. So each state is going to have to set up an exchange for the individuals and small employers in their communities. And it will be, the format's going to be a little bit different. Sometimes it's government, sometimes it's not.
All right, so if people who don't have insurance, and now they're going to be required to have insurance, what happens if they don't get insurance?
Well, they get a penalty. So this is what, you know, in 2014 you're going to have coverage. There are exceptions for religious exemptions and for financial hardship. If you don't meet those two requirements, you're mandated to have health insurance coverage, and if you don't, there's a financial penalty through the tax code. So at the end of the year, it's a little bit complicated, the calculation, but it's either a percentage of your salary or your income or a flat fee. To give you an example, 2016, it's going to be a $695 tax penalty, or up to 2.5% of your total income.
Now there are guidelines about what income criteria you have to meet, but I hadn't heard about there could be an exemption for religious reasons.
Yeah, so some of this is to be defined later, but there are certain exemptions for certain folks.
So they're out. They're out. They're out.
But for most folks, there are some loopholes. But for most folks, they are going to have coverage.
Are consumers, okay, so we've got this system that's going to be set up. Are consumers going to be given any guidance on which plan is best for them, or just, all right, here's your one-stop shop, good luck?
Yeah, so there's going to be an internet option where you can go. It's maybe like Orbitz or something like that, where you can go and there'll be information available online. It will rate health plans. It will give you information about how much it's going to cost. If you're eligible for a subsidy, it will tell you how much of a subsidy you're eligible for. But the exchange will not tell you which plan to purchase. You still, as a consumer, have to make that decision by yourself.
I like that comparison about the Orbitz, Travelocity, things like that. Yeah. All right, but how do you know, or how can you determine if the doctor's in your network?
Good question. So one of the things when you're purchasing coverage, if you're an individual, you have the benefit of being able to select a plan that your doctor may be in. So obviously one option that people do today is just to call their doctor and see if they're in the network or their local hospital if they want to be able to go there. But again, one of the things that the exchange is going to provide is information to consumers, and it will include information about the network. So you can go on, whether it's Aetna or Horizon or Cigna, you can go on and search the databases to determine whether your doc is in the network.
Okay, so now in these databases, are there going to be comparisons or any type of rating systems that people can take a look at?
Yeah, so one of the things that the federal government has required that all the exchanges do is to rate the health plans. I don't know whether it's going to be a star system or a grading system, but it will be a ranking system, and they're going to look at both price and quality in determining that ranking. So consumers will be given some direction and additional information that today they really don't have.
Well, when is it going to be available for consumers?
So it's going to differ depending on the state, but the federal law requires it that the exchanges be open as of January 1st, so coverage effective January 1st of 2014, but you can start shopping as of October 1st of 2013. So you could enroll, say, in October, but it wouldn't be for an effective date until January. It's going to be a little challenge. A lot of states are it's going to be a lot to build this, and we don't have much time left. But that's the goal. It's currently under the federal law.
All right. Well, a very complicated issue,
Yes.
and I appreciate you keeping in line with National Keep It Simple Week. And
I did my best.
And you did, because it is a difficult issue to understand, and we're learning as we go along.
Yeah.
Ward, good to have you here.
Thank you, Laura. I
All
appreciate
right.
it.